Good morning. I am Dr. Sree Professor of Surgery, Sree Balaji Medical College, Krompet, Chennai. Today I am going to talk about the history of surgery. The Western history of surgery dates back to 15th century in Egypt and the European history in 17th centuries, but the Indian history dates back to the Sushruta in the 4 BC. A renowned plastic surgeon. There are a lot of evidences for skull surgeries done in those days by archaeological surveys. The real development of modern surgery can be attributed to the discovery of asepsis by Lister and a lot of anatomical discoveries in the 18th century and anesthetic techniques and drugs in 19th century. Now we are in the era of minimally invasive surgery with the improved light and energy sources for laparoscopic and robotic surgeries. So first we will see the genesis of surgery. How do you know where you are going if you don't know where you came from? Said Maya Angelou. Surgery, the term derived from the French term chirurgien, the Latin and Greek for hand, that's chair, and work, that's ergon. Archaeological evidence for engravings in skull bone for craniotomy and all. You can see in Egypt, the oldest engraved recordings of circumcision and surgical tools found in Temple of Memphis. The earliest scientific document, the Edwin Smith surgical papyrus in 17th century. The manual for performing traumatic surgery that gives history of 48 cases. It describes the treatment of repairing a bone, that is a broken nose, the use of sutures to close the wounds. Infections are treated with honey. Mesopotamia, discovery of bronze instruments resembling scalpels found in archaeological sites in Mesopotamia. The Code of Hammurabi, the earliest Babylonian code of laws, specific legislation regulating surgeons and medical compensation as well as malpractice and victims' compensation. In India, the Neolithic graveyard in Megra had shown signs of drilling in the bones. The founding father of Indian surgery, Sushruta, 6 BC. He authored the Sushruta Samhita, the oldest known surgical text. It describes in detail the examination, diagnosis, treatment, and prognosis of numerous ailments, as well as procedures on performing various forms of cosmetic surgery, plastic surgery, and rhinoplasty. These are the various instruments used those days. And Greece, the Hippocratic Oath, written in the 5th century BC. The Hippocratic corpus include on articulation of joints, fractures, instrumentation, reduction. The physicians established was surgery, the injuries to the head, ulcers, and fistulas and hemorrhoids. Alexandrian surgeons were responsible for development of ligature, lithotomy, hernia operation, ophthalmic surgery, plastic surgery, methods of reduction of dislocations and fractures, and tracheostomy and anesthesia. In China, Huadua, was the famous Chinese physician, the first person to perform surgery with the aid of anesthesia. Middle Ages, the pitfalls. The surgery was frightening then, fatality were more, and infection was very common. So, for only dire necessity, surgery was performed. So, those days, the surgeons were called barber surgeons. They were minimally educated. Nowadays, the basic principle of surgery is the knowledge of human anatomy, controlling hemorrhage, and maintaining hemostasis, anesthesia and pain control, understanding and preventing infection. The knowledge of anatomy in 15th century, Andreas Vesalius, professor of anatomy, was the pivotal figure in the anatomy of surgical knowledge. He authored Anatomic De Humani Corporis Bafrica, the book. Eleanor de Sapadius, the first female surgeon in Spain and perhaps in Europe. German surgeon Wilhelm Fabry, the father of German surgery, first to recommend amputation above the gangrenous area. His Swiss wife and assistant Mary Colin improved the techniques for cesarean section, introducing the use of heat for dilating and stimulating the uterus during labor. The control of bleeding. Ambroise Parr, a French army surgeon, used an emollient made of egg yolk, rose oil, and turpentine for cauterizing battle wounds. He described more efficient techniques for the effective ligation of blood vessels during an amputation. He invented the Crossbeck, a predecessor to modern hemostat. Jean-Louis Perel, the screw compressor technique. And starting in 1980s, electrified devices used for cautery. Harvey Cushing and William Bowie used electroscalpel. The control of pain using narcotics, opium, and mandrake used for thousands of years but offered little effect. Mid 1930s, nitrous oxide was discovered. William T.G. Morton, sulfuric ether demonstrated as an inhalation anesthetic. William Halster used cocaine and infiltration anesthesia in over 1,000 surgeries successfully. James Corning and August Fleyer, the earliest experiments on spinal anesthesia. In 1920, spinal and epidural anesthesia were used in the United States and Europe. 1934, IV anesthesia using pentothal sodium. The control of infection. The post-op infection was the problem then. Joseph Lister, the father of antiseptic, based on his experiments and all, he proposed antibacterial application and dressing saturated with same substance. Lister's second major advancement, sterile absorbable suture materials impregnated with phenol. From antisepsis to asepsis, Ernest von Bergmann recommended steam sterilization. In 1878, manufacture of surgical gloves was done. In 1897, John Milklick's devised single-layer gauze mask for surgery. The further advances, William Roentgen, X-rays aided in diagnosing dislocations, fractures, detecting foreign bodies, and treatment of malignant tumors. Blood transfusion, late in 19th century, Carl Landsteiner discovered major human blood groups and RH factor. George Greil, first surgeon to perform a surgery during which blood was transfused. Richard Lowenstein demonstrated sodium citrate and glucose as an anticoagulant, thus paving the way for blood banking demonstrated by Geoffrey Keynes. Charles Drew, blood could be separated into two main components, RBC and plasma. The frozen section, late 19th century and 20th century surgical pathology exemplified by James Forget and Theodore Wilroth. Standardized education and training. Early 20th century foundation of basic surgical procedures in abdomen, cranium, and joints and thorax. 1870s or onward, state-sponsored universities held surgical training programs in Germany. Halsted implemented the surgical resident system in Johns Hopkins in 1889. 1920, AMA Council on Medical Education published list of 469 general hospitals and 3,000 approved internships, further expanded to 1,700 approved residents. The modern era. After the World War II, the establishment of large-scale urban and community hospitals with education and training program in surgery. Alfred Blalock worked on surgical shock. Alan Allfather Whipple introduction of the pancreaticoduodenectomy for pancreatic cancer. Owen Wangerstein decompression of bowel obstruction and advances in transplant and grafts and dialysis and effects of hormones and cancer. The important events in the timeline of surgery. 1900, the Harvey Cushing's began pioneering brain surgery. 1901, German surgeon George Killing performed the first laparoscopic surgery on dogs. 1907, Aston surgeon Harman Slaughter became the first to successfully remove the pituitary tumor. In 1910, Swiss physician George Christian Jacobius performed the first laparoscopic surgery on humans. 1916, Austrian surgeon Hermann Schuppan performed the first splenectomy operation. 1917, Kiwi surgeon Harold Gillens pioneered modern plastic surgery for wounded British World War I soldiers. 1925, the first open heart surgery by English surgeon Henry Schwetter. 1929, Werner Frenchman performed the first cardiac catheterization on himself. In 1931, the first sex reassignment surgery was done. In 1954, the first kidney transplant. 1963, the first liver transplant was performed by Thomas Starrs. 1964, laser scalpel was invented. 1967, the first successful cardiac transplant by Christine Bernard was done. 1967, the first successful coronary artery bypass surgery. 1982, JAVIX, the artificial heart, was successfully installed. 1983, robo-assisted surgery began with arthropod. In 1980, the first laparoscopic cholecystectomy by German surgeon Heinrich Much. In 2000, the Da Vinci surgical system was approved by the FDA. 2005, the first partial face transplant by French surgeon Jean-Michel Deboc. In 2008, the first full face transplant by French surgeon. In 2013, the first virtual surgery using Google Glass by surgeons on the University of Alabama, where they call virtual interactive presence in the augmented reality. In 2013, the first growing of a replacement of nose on a patient's forehead by surgeons of Imperial College in China. The future. Any sufficiently advanced technology is indistinguishable from magic, said Arthur C. Clarke. AL surgical robots, 3D printing, and new imaging methods are already used as a wide scale of procedures. 3% of surgical procedures are performed by robots, although 15% of all operations use robotic support. The virtual reality. In April 2016, cancer surgeon Sharif Ahmed performed an operation using a VR camera in the Royal London Hospital. Companies like Ozo VR, Immersive Touch, Aroma VR, and Fundamental VR have used VR on both training and encoding solutions. Augmented reality. The first AR-backed spinal fusion surgery in 2020, the US, where an FDA-approved AR guidance system helped surgeons visualize the 3D spinal anatomy of a patient during surgery. As if doctors had X-ray vision, the team of John Hopkins Hospital prized the tool for accuracy in safety and operating efficiency. The true 3D medical visualization system allows doctors to interact with the patient's specific organs and tissue in an open 3D space. Robotic surgery. The most commonly known surgical robot is the Da Vinci surgical system. The features magnified 3D high definition vision system and the wristed instruments that bend and rotate for greater than the human hand. The minimally invasive surgery, the vicarious surgical system, exceptional reach, and the ability to replicate all the moves of the surgeon and more. It creates a single incision just 1.1 centimeter across that still allows through two robotic arms and a camera. 3D printing. Penn State University recently repaired skin and bones by bioprinting during surgery in a rat model. In March 2016 in China, a team of experienced doctors decided to build a full-sized model of a heart of a small baby from born within a heart ailment. Live diagnostics, eye knife. Professor Jolan Chakatov of Imperial College London, and it's an electrical instrument where it produces heat issues make an incision with minimal blood loss. With the eye knife, a mass spectrometer analysis the vaporized stroke to detect the chemicals in the biological samples. This means it can identify whether the tissue is malignant or real time. Thank you.